Hello, I'm Ilker Manavbasi. I'm a plastic surgeon from Istanbul, Turkey. I've been performing plastic surgery operations more than 20 years, especially face rejuvenation and rhinoplasty surgeries since I finished my residency, and body contouring and liposuction surgeries more than 13 years. Let's start with liposuction surgery. Liposuction surgery is all about taking fat cells from the body. We use special cannulas and the machines producing negative pressure to take out these fat cells from the designated areas like abdomen, waist, back, arms and thighs. Nowadays we use these fat taking for special purposes like breast augmentation, the BBL, Brazilian butt lift, calf augmentation, and rejuvenation for the face and hands. How much we can take in one sit? Some countries and some states have upper limit for liposuction, but in Turkey there is no law for that. We calculate. We do some tests before surgery. According to blood count and patient's general health status, we predetermine the rough amount of liposuction. But during surgery, according to the bleeding and the patient response to the anesthesia, we can stop to a certain level or continue to take all the excess fat out, which is sometimes it can be more than 10 liters. But this is not the rule. Most patients, maybe 80–90% of patients, for the maximum level is around 5 to 6 liters. And we can easily take out this amount of fat for much of our patients. And for young patients and tight-skinned patients, after liposuction, we do not perform specific application to tighten the skin. But the patient aged 30, 40 or even younger patient have loose skin. They have looser skin after liposuction. So we need to tighten the area we do liposuction, like tummy, arms, inner thighs, upper thighs, anterior thighs, the waist, even the back area. For this tightening, we use J-plasma. What is J-plasma? J-plasma is radio frequency energy delivered to the area of liposuction, means under the skin. With the help of helium gas, this machine produces plasma. By producing plasma, we create instant spike of temperature, very minute time, and this plasma instantly cools down. So this machine is safe even with this high temperature, with very small fraction of a second. It is almost burn proof. I've done maybe 1,000 cases with this J-plasma. I've never seen any case with burn. So this is so safe. According to the other bipolar radio frequency machines, because these machines have monitor to screen the temperature of the skin during the surgery. With J-plasma machine, we don't need this fancy tools to measure the skin temperature, because this machine uses plasma which cools the tissues instantly. So it is so safe to use. And this J-plasma machine creates moderate amount of tightening. Of course, the results with J-plasma cannot compare to tightening surgeries like tummy tuck, thigh lift, arm lift. But with patients, their looseness is not severe, moderate amount of looseness. This machine can benefit too much. It prevents further big surgeries. So many patients love this application after liposuction. According to the amount of the fat aspirated determines the healing recovery period. Less fat taken means less time to recovery. If we do, for instance, less than 2 liters, the patient can go to work or do daily activities day after surgery, right after surgery. For these patients, we don't keep them overnight here in hospital. But if we do liposuction more than 2.5 liters, we need to monitor the liquid, the liquid patient drink or taking, or the urine output. We have to monitor these input and output to prevent patient from dehydration, which is quite dangerous for their health. So we keep them overnight at hospital and giving their fluid and antibiotic, keep them and monitor them, change their dressing, and the day after surgery they check out from hospital. Mostly, according to the level of liposuction, the amount of liposuction, they resume your daily activities, their job within a week. And if they come abroad or another city from beside Istanbul, so they can travel within days. We send our patient to their country within 5 to 7 days. If the patient has too much fat and loose skin, in that condition, we do liposuction along with body contouring surgery. What is body contouring surgery? Simply cut out excess skin in the tummy, in the waist, in the bum area, in the thighs, in the arms, in the upper back, in the breast, because obesity is a very common problem nowadays. Most of the patients suffer from this obesity try to lose weight by themselves, by going on a diet or doing exercise or having surgery to lose weight. And especially after losing 20, 30, 40 kilos, they are good candidates for plastic surgery operations, which are body contouring, which means the shaping the body. Liposuction is shaping the fat tissue. Body contouring is shaping the skin. We take out excess skin in certain areas. These surgeries are according to the patient's excess skin area, we devise a surgical plan for these patients. Sometimes one surgery is enough, sometimes 2-3 stages are necessary for these patients. And these are the general body contouring surgeries for certain types of plastic surgery patients. Thank you very much.